Hi everybody, welcome to Health Wanted, the place to be for healthy living. Today, we are going to talk about frontotemporal dementia, FTD, a lesser-known yet significant form of dementia that primarily affects the frontal and temporal lobes of the brain. Unlike Alzheimer's, which commonly impacts memory, FTD predominantly alters personality, behavior, and language. Understanding this condition is crucial for those affected, their families, and caregivers, as it requires a different approach to care and management compared to other forms of dementia. This video provides a thorough explanation of how FTD affects people by examining the causes, symptoms, diagnosis, and available treatments. Subscribe to our channel so that we can provide you with essential information to help you maintain good health and well-being. Let's go to the video. Frontotemporal dementia, FTD, is a collection of disorders characterized by a gradual loss of nerve cells in the frontal and temporal lobes of the brain. These disorders produce notable alterations in behavior, personality, language, and movement. FTD primarily affects people between the ages of 45 and 65. This is in contrast to more prevalent kinds of dementia, including Alzheimer's disease, which tend to afflict people at a younger age. Because it affects the basic foundation of an individual's identity and ability to function, this disorder poses special challenges for sufferers and their family. What is frontotemporal dementia? The term frontotemporal dementia, FTD, refers to a group of dementias that mostly impact the brain's frontal and temporal lobes. These regions are in charge of controlling movement, language, conduct, personality, and decision-making. The brain atrophy that results from the death of nerve cells in these areas can be broadly classified into three basic types. These include mobility difficulties, primary progressive aphasia, PPA, and behavioral variation frontotemporal dementia, BVFTD. Differential behavior frontotemporal dementia. This kind of dementia is typified by notable adjustments in social conduct and personality. BVFTD patients may display impulsivity, apathy, improper social behavior, or a lack of empathy. Relationships are frequently strained by these changes, and it can be challenging for people to keep their jobs or social networks. Primary progressive aphasia. This form primarily affects language skills. The capacity to communicate, interpret, read, and write gradually declines in those with PPA. PPA is further classified into three categories, each with a unique set of linguistic impairments: non-fluent/agrammatic variant, semantic variant, and logopenic variant. Movement disorders, Parkinson's disease or amyotrophic lateral sclerosis, ALS, like symptoms related to movement may occasionally be present in patients with frontotemporal dementia, FTD. These could include tremors, involuntary movements, balance issues, or stiffness in the muscles. Causes of frontotemporal dementia. Although the precise origin of frontotemporal dementia is unknown, aberrant protein deposits in the brain are thought to be connected to the condition. Certain proteins, like tau and TDP-43, build up in nerve cells and cause damage and eventual death to the cells. The frontal and temporal lobes decrease as a result of this damage over time, resulting in FTD symptoms. Genetic factors. Between 30 and 50% of cases of FTD are familial, or inherited. Certain genes, including C9orf72, GRN, and MAPT, have been linked to FTD through mutation. People who have a family history of frontotemporal dementia, FTD, are more likely to get the illness, frequently at a younger age. Sporadic cases. FTD is regarded as sporadic when there is no family history. Although the exact causes of sporadic FTD remain unknown, it is possible that a mix of genetic predisposition, environmental factors, and other unidentified triggers are to blame. Frontotemporal dementia symptoms. Depending on the precise subtype and the brain regions impacted, different FTD symptoms exist. Nonetheless, the three primary categories of prevalent symptoms are behavioral alterations, linguistic challenges, and mobility issues. Modifications in behavior. The most obvious symptoms are frequently behavioral ones, which can seriously interfere with day-to-day activities. Typical signs of conduct include personality changes. People may experience significant personality shifts, such as become impulsive, impolite, or socially inappropriate. They can start acting riskily or lose interest in self-care and personal hygiene. Apathy and withdrawal. It's typical to exhibit a pronounced loss of interest in pursuits or connections that were formerly significant. Isolation and social disengagement may result from this. Compulsive behavior. Certain people may start repeating routines, including obsessive eating, hoarding, or rituals. Emotional detachment. Relationships can be difficult when there is a perceived lack of empathy or understanding of others' feelings. Language difficulties. The main symptoms of primary progressive aphasia, PPA, are language-related. These could consist of difficulty speaking. Speech may become halting, slow, or hard to follow. Some people could have trouble putting words together or finding the correct ones. Loss of word meaning. Although a person is still able to speak, there are situations in which people lose the ability to comprehend the meaning of words or objects. Reading and writing problems. As we age, our capacity to read, write, and understand written language may deteriorate. Movement problems. When FTD impairs movement, its symptoms can mimic those of other neurological disorders. Typical symptoms associated with movement include muscle rigidity, akin to Parkinson's disease symptoms. This is characterized by stiffness or difficulty moving. Tremors, uncontrollably shaking or moving, especially in the hands or limbs. Difficulty swallowing, issues with swallowing that may cause choking or make meals challenging. Balance and coordination issues, trouble with balance and coordination, increasing the risk of falls. Diagnosis of frontotemporal dementia. Given that the symptoms of FTD might overlap with those of other types of dementia and neurological illnesses, diagnosis can be difficult. Furthermore, because FTD frequently affects younger people, it could be mistakenly identified as a personality change or psychiatric illness rather than dementia. And proper diagnosis requires a thorough evaluation by a neurologist or cognitive disorder specialist. Usually, the diagnostic procedure entails clinical assessment, to find possible risk factors or genetic connections. A thorough medical history is obtained, including family history. Along with evaluating the patient's symptoms, the clinician will look for behavioral abnormalities, language barriers, and mobility problems. Cognitive and neuropsychological testing. These tests evaluate cognitive function, memory, language skills, and problem-solving abilities. They help differentiate FTD from other forms of dementia, such as Alzheimer's disease. Brain imaging. To view the brain, imaging methods such as CT, computed tomography, scans and MRIs are utilized. Atrophy or shrinkage in the frontal and temporal lobes may be shown in these scans when the patient has FTD. Neurological function and aberrant protein deposits can both be evaluated with PET, positron emission tomography, scans. Genetic testing. To detect particular mutations associated with the illness, genetic testing may be recommended for patients with an early onset of symptoms or a family history of FTD. Treatment and management of frontotemporal dementia. Since there is currently no known cure for frontotemporal dementia, patients and their families are treated with a focus on symptom management and quality of life enhancement. To treat the wide spectrum of symptoms associated with FTD, a multidisciplinary strategy comprising neurologists, psychiatrists, occupational therapists, and speech therapists is frequently required. Medications. Although there are no therapies that can stop or reverse the progression of FTD, several medications may be able to assist control particular symptoms. Antidepressants. To treat symptoms like anxiety, sadness, or obsessive behaviors, doctors may prescribe selective serotonin reuptake inhibitors, or SSRIs. Antipsychotics. To treat extreme agitation, violence, or psychotic symptoms, antipsychotic drugs may occasionally be utilized. However, because of the possible adverse consequences, these should only be taken sparingly. Cholinesterase inhibitors, often prescribed for Alzheimer's disease, these medications are usually ineffective for FTD and may exacerbate specific symptoms. Non-pharmacological approaches. Non-pharmacological therapies are essential for controlling FTD in addition to medication. Behavioral therapy, aggression, obsessive habits, and social inappropriateness can all be controlled with the use of behavioral therapies. In therapy, caregivers may also learn effective ways to handle difficult behaviors. Speech and language therapy. For as long as feasible, speech therapy can support people with primary progressive aphasia in maintaining their communication abilities. In order to support clients with language issues, therapists may employ alternate communication techniques including writing or visual aids. Occupational therapy. The goals of occupational therapy are to help patients remain independent in their everyday tasks and modify their living space to make it more comfortable and safe. Therapists might suggest solutions or assistive technology to help in managing daily life activities. Physical therapy. Physical therapy can assist people with movement problems retain their physical function and lower their risk of falling by enhancing their strength, mobility, and balance. The complicated and difficult condition known as frontotemporal dementia has a significant effect on both the person with it and their loved ones. Although there isn't a cure for FTD at this time, people with the condition and those who care for them can greatly enhance their quality of life by learning about the illness and getting a diagnosis as soon as possible. Additionally, putting comprehensive management methods into place is crucial. Research developments could lead to improved understanding of this debilitating condition and potentially new treatments, providing hope for the future. That's all for today, and always remember to stay healthy. Subscribe to the channel to receive regular health tips and advice. Thanks for watching, and we'll see you in the next video.